Hello everyone, it's Dr. Qureshi, and today I wanted to really mention something that a lot of patients have been asking me right and left, because it's usually, I'll be honest, it's usually younger guys who come to me in their 20s or maybe even in their 30s, and they want to get a tinted windshield, or literally all the windows and windshield in their cars tinted really, really dark. And they come to me with a form that comes from the government, I guess, and they want me to fill it out for them and recommend tinted glasses. Now, when I talk about tinted, I'm not talking about just the light tint that you normally get in the front windshield in your cars, or maybe on the back windshield. I'm talking about entire car, all the windows, everything made out of glass. They wanted really, really dark, so dark that you can't even see the person sitting inside. So again, let me tell you something. As a doctor, I cannot recommend that for everyone. It has to be a medical necessity. That is the state requirement. That is the state laws. That is the medical law. And as a doctor, I have to follow the medical rules and code of ethics and the protocols. So sometimes the doctors cannot just do a favor for you. I mean, no doctor should do a favor regardless of what the situation is. But I'm just saying that from the medical perspective, I wish I could do my windows, all the windows on my car, tinted really dark. That would be awesome, because when I'm driving in the daylight, with all the heat and all the, the humidity, well, the humidity is not going to affect the windows, but I'm talking about in the terrible weather when I'm driving with the bright sunlight coming towards me when I'm driving on the highway, especially when I'm going to work. It's definitely going to benefit me. So if someone had to get the windows tinted, I would be the first one to do it. And I can't even do it for myself. Trust me, because I have to have a medical necessity for doing that. So the bottom line is, if you come in, and trust me, I've done it for some patients. It's not the norm. I'm not going to do it for everyone, but there has to be a reason. There has to be a medical necessity. So don't get disappointed. Don't get frustrated if you come in with a paper. And like I said, I have hardly seen a girl coming in with that paper. Always, like literally always, guys, younger guys coming to me and asking me, telling my nurses, please ask Dr. Qureshi to fill this form out for us so that we can get the windows tinted. I don't understand the obsession with getting the windows tinted. I think last time I checked with my person who sold me the car, the salesperson, he said that it actually brings the value of the car down. So check on that, because if the resale value is going down, why do you want to get the windows tinted? So in order to have a good car, and if you want to sell it for whatever rhyme or reason, don't get your windows tinted. That's what I was told, at least. So maybe you should look into that as well. So having said that, coming back to the medical point of view, if I see any pathology happening in the macula, which is in the retina, as I have always mentioned to you, if I see any pathology going on in the macula that could possibly lead to a condition where definitely it is difficult for you to drive with the sunglasses on, you have the regular tint on the front windshield, and you still are having difficulty driving because of the medical condition happening in the macula, in the retina, then yes, I will definitely go ahead and say yes in the form that this patient definitely needs the extra tint on the windows. Or if I see a neurological condition, because I remember there was one guy and he was, I think, in his 40s, and he definitely had a neurological condition, but I just didn't write the tint for him immediately. I had to run a lot of tests. I even had to get records from his neurologist and figured out a reason for him to get the extra tint on his windows. Turned out that he had a condition with the cones. You know how we have the cones that help us with the daytime vision in the retina, and then the rods that help us with the nighttime vision? He had definitely a condition where he was born with cone dystrophy, with the cone problem. So he definitely needed that from the medical perspective, and I went ahead and I filled out the form and signed it for him. And if you have any other pathologies in the optic nerve, where you have some condition going on where you definitely need this extra tint, then yes, I will go ahead and do it. But I'm not going to do it randomly for everyone, because again, it's my license, it's a liability issue, And if you get caught by a cop, he's definitely going to ask, hey, who did this for you? Like, who recommended it? Because tinted windows are not done without the doctor's permission, without the eye specialist's permission. So just be careful. Please be mindful of that, and don't get sad. Don't get disappointed if you don't have the tinted windows, because you do not fall in that category to get it done. Okay, so I hope that makes sense. And just drive safely. Be careful, especially on the highway. Bye-bye.